A lot of you guys want to know why I got a facelift so young, so I'm going to explain to you guys the backstory.
Hi everyone, Dr. Chiu here. I'm sure many of you have seen the viral clip of the 24-year-old who had a facelift, and I had some people who wanted me to comment on that. First off, it's not very common for a 24-year-old to consider having a facelift. Her reason for doing so was a previous jawline reduction that she had done in Korea, which is not being done here in the US. And there's reasons for that because it does change not only the aesthetic look of things, but also can impact the function of your jaw, or in other words, your chewing, speaking, and such. Let's just say that it's considered very risky. So it's not a surgery that is commonly done here in the US, even by OMFS surgeons. She noticed afterwards that she had more folding and heaviness of her nasolabial folds, and also some laxity underneath her jaw and along her jawline. And the funny thing is that she doesn't address taking care of those issues. If this was something that was concerning to someone where they reduce the underlying bone support a little bit and you have some laxity due to that, you can do a non-surgical treatment to help improve those things. One of my favorites is microneedling with radiofrequency, like Silfirm or Morpheus. Also, you can consider doing oil therapy to help tighten up the tissues. Now, if she had some excess volume in the area, she mentioned a heaviness in her lower face, you can actually treat that with some liposuction to just thin things down. After all, you're not talking about having like a cup of fat there, and this is something that's more genetic than anything else, especially at her age. That can be taken care of, as well as using microneedling with radiofrequency to help reduce and melt some of the fat. But the fact of the matter is that she didn't address this as of yet, and instead considered addressing her mid-face and upper face. Doing a more traditional full lift is kind of extreme for that age group. We haven't even allowed your face to fully develop. A lot of patients going through their 20s will notice their face starting to slim, especially in their early 20s, and maybe she's just a little bit of a late bloomer where it hasn't completely slimmed down from the baby fat of her teenage years. So if you have similar concerns, feel free to contact us and we'll be happy to see you and help you in your evaluations.